Good sign.
Okay, so far so good. We'll remember to share the screen. You'll remind me perhaps. Anyway, we want to welcome everybody who's online and here in class in person. It's a rainy, dark night here at the Grange, but we have some brave souls who've managed to make it to engage in an interesting session on substances and their use. And Elisabeth is here to share her knowledge with us. We're excited. She's, our #1 keeper of the books, which we really appreciate, and everything else that you do. So go ahead and tell them a little bit about yourself, perhaps,
Sure.
and then we'll get started.
All right, sounds great. How is the volume? Can you hear me? Should I use the mic or can people hear me okay? Yeah, Ted, can you hear me okay? Okay. Yeah. I can use the mic or you could move up a little bit, whichever is better for you. Why don't I try using the mic? I'll move again back where it was.
Okay,
Get that going.
sure do. Okay.
Okay. How's the? So Ted, maybe you're okay. Can you hear me now? I'm sorry, I made you get up and then.
Yes.
Yeah, so my name's Elisabeth Maxwell. I am your librarian. I've been coming since, I don't know, last summer sometime. I feel like the weather has definitely changed. There used to be light when I would drive here and I was easier to find. Charlie and I talked about both getting a little lost in the dark and the rain, but we made it, so yay. So yeah, my name's Elisabeth Maxwell and I work for Lane County Public Health, which is so Scott works for the county as well. So he works in the medical area and I work in the public health area. So I have a PhD in public health and a master's degree in public health, both from Oregon State University. And I manage the prevention department for Lane County Public Health. And I've got some slides that I'll talk to you about here in a second. And just like with most folks who've come, I'll share a little bit about how I came to be a whole food plant-based person. I became a vegetarian in high school. I won't say how long ago, and I was growing up in Montana, and at that time, being a vegetarian, not super easy. It was not accommodated super well, although I was super lucky. My parents accommodated me. I made this announcement that I was going to be a vegetarian for ethical reasons. And my mom just was like, okay, and she became a master at, those 9x13 baking dishes that you make casseroles in. She constructed a way of making a tinfoil fence in the middle. And so their, version of lasagna or enchiladas on one side with meat, and then my vegetarian one on the other side. Looking back, I think there was some seepage. At the time, I didn't really think about it and appreciated that she accommodated me in that way. And I've been very lucky. They've been that way ever since. And then I went to college in Montana, met my husband, and really fortunate, was able to convert him pretty quickly, just told him why I did it, why I didn't wear leather, that I was, didn't want to hurt animals, and he became a vegetarian. And then we had 2 children and raised them both vegetarian. And, I knew things, I did know things, just like all of us, many of you have told the stories. I knew things and I chose not to know those things. And so my daughter and I would kind of dip in and out of being vegan, and we'd do it for a while and then it would get hard for some reason. And so we'd stop. She has a story that she says she thinks that we were vegan for about a year when she was in high school. I don't know if I remember it exactly that way. But I'm older, she's younger, she probably has a better memory. So I'll go with what she said. And looking back, I became fully plant-based a couple years ago, and I have felt some guilt at times about, not going sooner or not raising my family plant-based, and had talked to my kids about it. And both of them, we knew this, but both of them have talked about being bullied, for being vegetarian. I know, right? Good old hippy dippy Eugene, and they've still had times where, and that's what they called it, was being bullied. And they both said that it would have been worse if they were fully plant-based. So small comfort, right? And I just have to think that we all got there in the way we were intended to get there at some point. So I went fully plant-based a couple years ago, and luckily my husband again was just like, okay. And not much. I do all the cooking, so that helps there. But, you know, showed him some of the movies, watched Game Changers, watched some of the other ones, and he very quickly was like, sure, yeah, great, you know, and so he's fully plant-based. My daughter doesn't live with us, she's an adult, but she also went pretty quickly. I would say she's not whole food plant-based, she's still more in that vegan category. You know, she likes all the vegan processed foods that are all the rage now. I think Charlie and Scott call them the transition foods. So we'll hope that that's where she's headed. And then disappointingly, my son is still just a vegetarian. So there's hope though, right?
Yeah.
So yeah, so that's how I got here. And yeah, if you want to cue up the slides.
As long as he's not on the carnivore diet.
Nope. Vegetarian, so take it as a win.
Yeah. Yeah. Okay, so we're gonna share the screen. So we just need to share it first. And we're gonna, I don't think you have sound, but we'll share it anyway.
Did you hit record?
And then
Yeah.
online at everybody, can you say yes or not? Or one of you? Can you see the screen okay?
No.
Online? You can't
nothing
see the
online.
screen?
It says it,
Oh, there it is. It's just really low quality right now. Yes.
You can see it?
I see it now. Yep.
Huh?
Okay,
good
deal.
All right.
Oh, okay, good deal.
Yeah.
There we go.
Oh.
The other way.
Oh, I think we have to come back over there. Oh, this
There we go.
Okay.
Think we've never done this before.
Yes.
Yes, it is.
All right. So one thing you
Something dropped, I think it was a chocolate chip.
Okay, so I'm gonna mute the sound in the room, or I'm gonna like ask you to keep the sound down or mute yourself for now, because it's kind of showing up in the room here. For those of you online, you should be able to hear. If you can't hear, unmute yourself, let us know.
Great.
Okay.
Can you go back to the first slide just for a second?
Oh, you really want that first slide? Okay. Okay, good.
Say, you're gonna learn a couple things about me, hopefully more than just a couple, but you're gonna learn I love color. So this is your introduction, bunch of color. You're also gonna learn that I love animals because there's a bunch of animal pictures coming. I gotta keep you awake. Okay, go ahead, Charlie. All right, so I work in public health. So what is public health? Public health promotes and protects the health of all people in their communities. It's science-based, evidence-backed, and it strives to give everyone a safe place to live, learn, work, and play. And for those of you who don't know, the motto of Lane County is also the best place to live, learn, work, and play. So that's just an odd little coincidence. And that graphic there is from National Public Health Week, just showing, people being empowered and healthy. Go ahead to the next slide. And so sometimes people wonder, how is public health different from healthcare? And sometimes there's a lot of interplay and it's not totally different. So this is just kind of a treetop view, a generality, but public health tends to focus on population level health and healthcare tends to focus on the person in front of them. So when Scott and Charlie are seeing a patient, they are focused on the person, that patient in front of them, and that's what they're thinking about. Does that mean that they don't know things about public health and they don't know when to call the public health department? Of course not. They know, when to do those things. But in general, in public health, we tend to focus on what's good for all of Lane County, or what's good for the entire state, or what's good for a subset of the population in Lane County. And so we don't deal so much with individuals, although tonight, right, doing this class is kind of individual based, but we tend to do things on a population level. Go ahead. And so what does public health do locally? So this is just a snapshot of our local public health department. So we've got a communicable disease department, and they do sexually transmitted infection treatment and prevention. They help with immunizations, trying to make sure that kids are immunized. You know, there's a big push when kids go back to school to make sure that they've got all the right immunizations. They also help with reportable diseases, so things like HIV, tuberculosis, they do investigations. We also have an environmental health department, so does anybody have a food handler's card or have to go get a food handler's card? Yeah, so that's where you get that. And they do our restaurant inspections, they inspect our pools, our hot tubs. They do drinking water inspection. They're kind of behind the scenes, making sure that people are not getting sick from foodborne illness or not getting sick from pathogens in water. And that's kind of invisible, I think, to most of us, you know, that they just go out and do that and we're not really aware of that. And then we also have a family and child health department, which is just what it sounds. When someone becomes pregnant and they might be low income and need resources and services, there's nurses that will actually go out to people's homes and help them during those times and through after the baby's born and when they're young children. We also have a mobile public health department. So all of you are probably aware, Lane County is really big, right? So Oak Ridge, pretty far away, Florence, pretty far away. The county public health department is still responsible for all of those places. And so it's hard for people to come into the public health department or come in and see Scott maybe at one of the health clinics. And so we actually have vans and we send them out to do immunizations. We give Narcan out to the community. I'll talk about WIC here in a second, but we've got WIC workers that go out to those communities and meet people where they are so that they don't have to come in to Eugene, because it's a pretty, you know, from Florence, any of you, it's a pretty good commute, and that road to Oak Ridge can get pretty crappy this time. And then we also have prepared, so disaster things that start happening. We've got prepared animal that, you know, when that's affecting our rural areas and there's farm animals, you know, these people and their animals safe and fed and watered. And that's the unit that does that. And then mine is what I supervise. In red, there's prevention and health promotion. So we work on youth suicide prevention, tobacco prevention, alcohol and drug prevention, and problem gambling prevention. We prevent all the things that are a problem. And so I'll talk about that more in a second here. And then WIC, probably a lot of you have had some interaction with WIC, but they provide lactation support.
Sound is
Um,
cutting out.
In to convince lawmakers or people with money to put resources money to something that's not yet. And so that's what we're trying to convince people, right? Let's stop kids smoking, they're young, so that we don't have people with lung cancer when right.
No sound.
Oh, they just. Oh, no, there he is.
Personal, right? That you leave here and you tell your friends and you tell your family and your coworkers, and then maybe that message starts getting spread, right? And then we hope that maybe it becomes institutional, right? Scott and I both work for the county. We've started having some talks. Is there anything that we could do as county employees to make some institutional change at our work? You know, there's hospitals that decide that they're going to make sure that they're offering whole foods, safe food stations, and they're in. That's, I think there is happening. but it can. And then community, so thinking about something like if we're trying to promote whole food plant-based living, community gardens are a great way to do that, right? So what if all of these things are spreading through the community, and then the commissioners get into this, say, wow, we need more community gardens. And then what if that becomes state level? What if at a state level, some legislators become interested in that and say, you know what, we should actually have, for every 500 people in the community, there needs to be a community garden, and they legislate that. That's the best possible thing that can happen in public health, right? Because then that's law, right? There's no more argument about it. There's nothing to talk about. I don't need to convince anybody anywhere about anything. I just get to say, oh, I'm sorry, that's a law. How can we help you? So think about something like Tobacco 21. So I think it's about 10 years ago. So there was a time, right, in most states where, you know, kids up to in 18 was the cutoff for tobacco, right? And so they could buy 18, at 18, they could buy tobacco. Lane County actually passed it before that, and then the state passed it. And so then it's not a conversation anymore, right? You don't need to talk to anybody about, well, you know, somebody can join the military, but they can't buy tobacco. I'm sorry, it's the law. We don't need to talk about it.
So we lost our connection with the Zoom people. We'll
Okay.
try hooking up.
I thought she just
To
said that
see
you can't.
if we can get a better run.
Share screen.
You think it's an internet kind of thing that said it was slow, or it was, that there was a problem?
The range seems less
Just kind of took us off. Meetings. Schedule meetings, it's been there.
Recording is not.
Okay. So we're back again. I'm gonna share the screen again. And share it. Hey. Share it. And then we're gonna go to. Okay. Scott, you see that now?
Yeah.
We're back on. Okay, good. So continue on with. How do I get that off of there? Where did it go? Stop share. Let's go back to your PowerPoint. And it's this one here.
It's a wonderful opportunity to breathe and take stock of your.
From current slide. Next slide.
Yes, please. All right, so this is just a callback, something that Scott and Carly have talked about a lot. So pillars of lifestyle medicine.
Let's take this.
You're okay? Everybody here okay? Okay, move or let me know. So P Hero is showing you where we're gonna be spending our time tonight, so minimizing harmful substances. Lifestyle medicine for people to stop smoking, reduce excessive alcohol consumption, avoid addictive substances, and behaviors such as gambling or harmfully excessive internet or social media use. So just kind of showing where we're at tonight. Go ahead. So this. Determinants of health.
Hey Scott, we're getting a little bit of an echo from your phone.
So what is the echo?
Scott just needs to mute the microphone on his phone.
Scott, you wanna turn your mic, your thing off?
Okay, there. Much better.
The microphone. I don't know if you can really mute the microphone. Okay,
How's that?
yeah, that's fine.
Better? Okay, so social determinants of health. So it turns out that health is not just one thing. You can think about health as a bucket or this little person in the center of this. And so there's a whole bunch of things that go into a person's health and how healthy they are or not. So having access to food, right? So if you don't know where your next meal is coming from, that has an impact on your health. If you live in a food desert, that has an impact on your health. If you have access to wonderful, fresh, healthy, plant-based food, that has an impact on your health. We've been talking about that. Having access to healthcare also has an impact on someone's health. Housing. Do you have secure housing? Do you not have secure housing? That has an impact on someone's health. Mental health, having access to the correct kind of treatment and medication has an impact on someone's health. Transportation, huge, right? Probably for most of us in the room, you know, we drive, you can get to the grocery store, you can do errands, you can get to your medical appointments. How much does that change if you don't have access to a car and you have to take 2 bus trips, you know, to get to the grocery store, get your kids to the doctors? That's a huge impact on someone's health. Education, income and jobs, obviously, you know, having a income that you can depend on has an impact. Isolation, we've talked a lot about that. Scott and Charlie have both talked about that. Pam talked about that. Loneliness and isolation has an impact on someone's health. And environment and safety, right? If you live next to a factory that's spewing out chemicals, that's going to have an impact on your health. It's going to have an impact on your mental health and your physical health. Living in a neighborhood where you don't feel safe, you know, where there's violence and you don't feel safe going out at night, you can't recreate or go to a park. All of those things have an impact on health. And so we call those the social determinants of health. You can go to the next slide. And so it turns out that the social determinants of health are associated with the risk of substance use. Does this mean that it's causality, that this is, you know, something that definitely happens? No. But you can see that if somebody doesn't have access to food and their housing is insecure and they live in an unsafe environment, the risk of substance use goes up. So just the risk, and we're not ever talking about an individual or the probability of an individual, but just the risks, and we work on those. Go ahead. And so just a note, you know, how we talk about people who suffer from addiction. And so sometimes you'll hear people talk about addicts, and even somebody who, you know, suffers from an addiction might call themselves an addict. But when we're not a part of that community, we call it using person-centered language. And so saying people who suffer from addiction, people who suffer with an addiction, people living with an addiction. That way it's describing the person and it's not describing who they are, not saying something unchangeable about them, or it's not saying that that's it's always gonna be that way. And it's important because people struggle with addiction. It's not who they are. It's not permanent. Recovery, there's lots and lots of people who go into recovery and they're successful and it provides hope, right? And so just a note on that. Go ahead. Your computer doesn't like you.
Is that the next slide?
Go back.
Huh. That is really pretty aggravating. Oh, we gotta go back too.
There, stop it. Oh, go forward one. There we go.
Okay.
There'd be cute animals. Here's an octopus. It's colorful and it's cute and it's pretty. So it has nothing to do with the slide. But addictive substances, you know, things that people can struggle with: alcohol, legal and illegal drugs, tobacco, nicotine, and food. Go ahead. So other things that people might struggle with: problem gambling. I have one person on my team and we are funded through state lottery dollars. And that's all she works on is problem gambling prevention. There's also free treatment in the community for people who suffer from problem gambling. And as you might imagine, often when someone's suffering with one thing, they might be suffering from something else. So you think about problem gambling, they might also have problems with alcohol or mental health issues. Gaming, she also works on gaming. Shopping could be an issue, sex, exercise, really anything that, you know, there's lots of things. This is not an exhaustive list. Go ahead. So definition of addiction, this is from the DSM. And so this is not my area of expertise. I just give it to you as an overview. If you have any very specific questions, Pam is here tonight. She is our mental health expert. But I think it's an interesting thing to look at. If you or someone you know is struggling with something, this is, an interesting thing that you can look at. Is the person's use of whatever it is it uncontrolled? Do they seem like they don't have control over what they're doing? Are there social problems? We're coming up on the holidays, and so if someone's having trouble with alcohol, holidays are a great time where that can come out, right? Where, there can be family friction or friction in a household. Having, withdrawal symptoms, sorry, can't, it's too small on Charlie's computer. Having withdrawal symptoms, dangerous use, right? So again, thinking about alcohol, dangerous use, drinking and driving, right? That's something that's very dangerous, and other things that people can be addicted to can have impacts on their health, even food, right? Food can also have an impact on someone's health and be dangerous for them. Excessive time thinking about it, excessive time obtaining it, excessive time, whatever it is that they're engaging in, the alcohol use or drugs or whatever, but just that it's become something that's kind of taking over their lives, and it's excessive and they're feeling upset about it. Unsuccessful attempts to cut back, right? That's a hallmark of struggling with something. And continuing to use despite negative consequences. So going back to that alcohol issue, if you get a DUI, I think that might be a wake-up call for a lot of people, but for some people really struggling, it's not a wake-up call, and maybe they end up with another DUI, or they end up, doing something else that, has negative consequences. Go ahead. So these are just some of the substances by the numbers. So this is a survey that's done every year. This is the latest, this one was 2022. But this was a survey in Oregon within the last year, and this is adults, so this is people over the age of 18. 25% reported illicit drug use in the last month. That's 1/4 of the population. That's pretty large. 33% reporting cannabis use. Now, that doesn't mean the cannabis use, that's just reporting cannabis use, right? That doesn't mean that it's a problem, doesn't mean that the person is struggling with it. However, that is 1/3 of our population, right? And so the legalization of cannabis has definitely had an impact on our community. 4% reported prescription drug misuse in the past year, 58% reporting alcohol use in the past month. And again, that's not saying it's problematic. People can use alcohol and it's not a problem, but it's a pretty high number, right? And I think we all know alcohol is pretty ubiquitous in our society. And 24% reporting binge alcohol use in the last month. And I'll define that in a second. But again, that's 1/4 of the population. That's pretty large. And 23% reporting actually having a substance use disorder. And I don't think that somebody would report that if they hadn't been diagnosed with it. That's not something that somebody would just probably self-diagnose on the internet. And same thing with alcohol use disorder. So 13% reporting alcohol use disorder. And then I just throw tobacco in here because I think depending sometimes on what population, where you hang out, what your social influence is, sometimes you think, oh, cigarette smoke, haven't we solved that? Have we solved tobacco? No, we definitely have not solved it. So 16% of adults reported cigarette use in the last month. And if you start looking at that by population, so take it by age or by ethnicity or income level, that number can get really high. It can get to be almost 50% in some populations. And so hugely concerning when we know that tobacco use is the one thing we know for sure causes cancer.
This looks like you have a lot of job security.
I think I probably do. Also, oh, the animal, who knows what the animal is?
Salamander?
No, it's an axolotl.
Oh, it's a what?
It's called an axolotl. They're pink and I don't know, they look like sort of stuffed animals, but they're super cute. So if you're ever having a bad day, just look on the internet for a picture of an axolotl and it'll make you happy. And they kind of have faces that look like they're smiling. So it's amazing. Okay, go ahead. So what is considered a drink? So you've got 12 ounces. And so the ABV is alcohol by volume. And so a beer, 12 ounces, and I can't read what that says, but 5 ounces alcohol by volume. And then a malt beverage, 8 ounces, and it's 7% alcohol by volume. And then wine, 12%, 5 ounces. And in college, what I would have called a shot, 1.5 ounces, and that's 80 proof. So some of that is okay, right? So you go to the store or you go to a bar and you buy a bottle of beer, you know kind of what you're getting. What's the problem with wine glasses and shot glasses?
Size.
Yeah, I mean, does everybody in here, like, we all have the same size wine glasses? And when you go to a restaurant, they're all the same size wine glasses, and the person pouring is pouring the same amount? I don't think so, right? And then, with those, I don't know what else to call it, the shot glass, I feel like that's a weird term to use, shot glass. But the shot glass, same thing, right? I think in a restaurant or a bar, they're supposed to measure. Do they always measure?
No.
So sometimes people, you might be getting 1.5 times the serving that you think you're getting. You're like, oh, I'm having one glass of wine. That can lead to a DUI, right? When you've had more than you think you've had. So just a note about drinks. And then these are some more cute pictures. Has nothing to do with the slide. But alcohol use and misuse definitions. So this is just how drinking is defined. So moderate drinking, so 2 drinks or less in a day for men, 1 drink or less for women. And binge drinking, 5 or more drinks in 2 hours for men, and 4 or more drinks in 2 hours for women. And then heavy drinking, 5 or more drinks per day, or 15 or more drinks per week for men, and 4 drinks per day, or 8 or more drinks per week. And so this is somewhat useful, right? It would take an actual, like somebody to diagnose, whether you actually have this or not. But if you have questions about your amount of alcohol, it's useful, right? That maybe you're like, oh, I didn't realize that much alcohol is actually called binge drinking. I didn't realize that. Go ahead. So some health risks associated with alcohol. So last week, Scott talked to us about cancer, and he talked about, the leading causes of death in the United States. And so these are pretty much the same ones that he talked about: heart disease, cancer, accidents, stroke, Alzheimer's disease, diabetes, kidney disease, and chronic liver disease. What is something that's common to all of those? Let's say alcohol can play a part in all of those, right? Every single one of them, alcohol increases the risk, right? So accident, Charlie, weren't you an emergency room doctor?
Yes,
Do people have accidents in their homes when they've been drinking?
absolutely.
Yes, right. And then we know with motor vehicle accidents, what happens, right? And that others is a little bit small, but Scott talked about the cancers, and so you can see all the cancers down there at the bottom that are increased with excessive alcohol use. So liver cancer, colon cancer, breast cancer, cancers of the oral cavity, rectal cancer, and alcohol is associated with basically organ damage across the entire body. So you've got GI system affected, the liver affected, the oral cavity, cardiac effects, neurologic, lung, muscle, pancreatic, bone. It's hard to find one where there's not an effect, right? And the problem with alcohol is, like I said, it's so ubiquitous in our society, right? Alcohol is everywhere. It's considered socially acceptable. It's pretty hard for people if you're trying not to do that for some reason. I really found this out. My son played sports in high school, and so there was a period of time where I wasn't going to be able to talk to him if I didn't know a little bit about sports and teams and stuff. And so I ended up watching more sports and football and stuff than I ever wanted to. But what I noticed is all the alcohol ads, the drinking, we were able to go to a couple of professional games. Oh my gosh, so much drinking, so much alcohol. You go to a Duck game, well, it's just so much. Watch the Super Bowl and track how many ads there are for alcohol. It's pretty rough. And you can also track the ultra processed food ads. Those are also rough. Yeah.
But you still can get some of those diseases without drinking.
Of course, yes, but the risk is increased. Yeah, it doesn't, that's the point, it's just that the risk is increased with drinking. Yeah, good point. Yeah, go ahead. So the health effects of cannabis. So I think sometimes, especially with young people in our society, there's a tendency to think, cannabis, no big deal. There are effects. So there's effects on the mental health. Daily or near daily use of cannabis can contribute to dependence and mental health problems. It's also associated with a severe lack of motivation in young people. It really, that brain is still developing until kids are 24, 25. It's definitely affecting that. Driving, they've done lots of surveys with young people and also adults, where a lot of people don't think that cannabis has an effect on your driving. I have sat on the fatal crash investigation team for the county for a number of years. And what I can tell you is about 1/3 of all fatal crashes on county roads involve substances, and they almost never involve one substance on its own. It's pretty rare anymore to find that somebody has died on one of our roads in a motor vehicle accident because of substances, and it's just alcohol, or it's usually a cocktail of alcohol and cannabis and then a bunch of other stuff. So kids tend to think it's innocuous and that it's okay to drive, and it's really not.
It seems like on at least. There's a shop to buy cannabis.
But it's really hard. We have kind of a pro-business. A lot of our lawmakers are pretty pro-business right now, and so it's really hard to legislate that. But yeah, it's definitely a problem. Effects on the respiratory system. So it kind of makes sense, right? If we know that combustibles like nicotine and tobacco cause lung cancer, it kind of makes sense that combusting something and breathing it into your lungs is probably going to have negative health effects. There are not as many studies because of the federal ban on cannabis, and so it's hard. It's not been studied as well. But I think it's kind of a common sense thing. It just makes sense that it probably is not good for your lungs. And obviously with pregnancy, substances in cannabis definitely are transferred to the child during pregnancy or breastfeeding. And so the safest thing to do is not to use. Anybody know who this cute animal is?
Oh,
Yes, it's Mudang. She became a big thing right this fall. I can't remember where she is, but she's little and wet and cute.
yeah.
Thank you. That sounds right. So in prevention, we like to say that it's all connected, because it's all connected, I think. Go ahead. And probably at this point, you might be saying to yourself, oh my gosh, how long have we been in here? And she's not really talked about food yet. Is she ever gonna talk about food? Here we go. We're gonna talk about food. So how is food related to other substances of misuse? And I think I've got this one on little triggers. Yeah. So alcohol and other drugs affect the prefrontal cortex. This is where your decision making happens, right? And so alcohol has a direct effect on that. And this can negatively impact impulse control and emotional regulation, making it harder to resist cravings. And I know just in here, I've heard class members talk about, oh, I set my intentions for the week and I'm going to do whole food, plant-based living. And then Friday rolls around and I have a glass of wine. And then I find myself elbow deep in an M&M's bag. And like, well, yes, that can happen, right? And it can happen because, your intentions have been worn down a little bit. You're not making as great of decisions. You also might have an association, right? Maybe you associate drinking wine and M&M's. And so it's hard to break that association. Next one. And so one substance can impact cravings for another substance, right? And so if food is something that you're struggling with, and maybe I keep picking on alcohol, but maybe in college you had good associations with you've been drinking, and then you have a burger and fries. And so when you drink a beer, you think, oh, burger and fries, right? And well, that goes against, that's not whole food, plant-based living, right? That's maybe not the intention that you had for the week. And so being aware of that. Next one. And all the substances definitely have an effect on memory and learning, right? And so you make those intentions for the week, and then if you use something, it can take that whole system offline and impact your ability to be able to do it in the future as well. Next one.
Someone was asking about the health effects of vaping
Oh, not good.
online. You want to make a mention of that while I'm trying to advance this? Sorry.
Vaping also less well studied. I don't know if anybody remembers this, but right before COVID happened, there were a whole bunch of young people ending up in the hospital with pretty severe lung injuries that were associated with vaping. And then COVID happened, and so we all kind of forgot about it. But it's definitely still out there, and same principle, right? Something that you're combusting and breathing into your lungs, it makes sense that it's not good for you. Definitely not good for young people. So what is unique? Anybody know who he's not cute in the same way? Anybody know who that is?
Wolverine.
Wolverine, yes, thank you, folks. Wolverine, so I'll, yes, Hugh Jackman. So I'll touch on why I've got him up there in a second. But what's unique about food? So I've got a couple of books back there that I actually stood up. So we've got one, Michael Moss, this is his salt, sugar, fat. We've also got his other one cooked back there. And so he's done a whole bunch of work on trying to show people, oh, what are the food companies doing? Like, why is it hard? This little tagline here, but you can't just eat one. they engineer it that way, right? They engineer it so that you can't, the hyper palatability. They have these food scientists that are working on, oh, what's the salt and the mouthfeel and what amount of sugar makes it so that you want to eat more, right? It's their business model to get us to eat more, right? And so I find this picture of Hugh Jackman really annoying, because he's been Wolverine for what, maybe 20 years, and every time he has to get ready for that role, he has to get all muscled up. And so stories start coming out about what he's doing to make that happen. And the story is always, oh, well, he's eating skinless chicken and broccoli. And as we know from watching Game Changers, he actually doesn't need to do that, right? He could bulk up just normally. There's other people who have done that. Is he eating Lay's potato chips to look like that? He's not. So
Yeah.
that annoys me greatly. So ultra processed foods that have 5 or more ingredients, and the SOS is salt, oil, and sugar in the top 5 ingredients, and then having a bunch of unrecognizable, unpronounceable ingredients, right? And so all of us, right, it's pretty hard for most of us to have no processed foods in our home. When I was getting ready to come here tonight, I was thinking, what do I have in my house? And so I looked in the fridge and I have some hummus from Costco, and I thought, I've never looked at this label, and how terrible is this gonna be? It wasn't the worst. It was, the first ingredient was chickpeas, so that's good. The second ingredient was tahini, it's okay. And then it started getting a little, everything was understandable and pronounceable. I did like that. But, you know, it had sea salt and it had some canola oil. If I made my own hummus, I probably wouldn't use a whole lot of tahini. I wouldn't use that oil. I definitely wouldn't put salt in it, right? If I'm using canned beans, you don't need salt in that. But all of us are busy, and so you make choices, and sometimes, you know, so you just try to do the best you can with the food. Go ahead. So it's almost impossible to become addicted to these beautiful foods. Right? So you've got our beans and our lentils and our whole grains and the beautiful fruits and the beautiful vegetables. So that's what we're always trying to talk about in here, right? Our whole food, plant-based living, and that's what these are. Go ahead. So what do we do if we're struggling with some unhealthy food issues? So I've got a toolbox there, Calvin and Hobbes, because it makes you feel good, right? A tiger and a kid hugging. If you hit it, the graphic. There we go. So these are some strategies we can use if you're struggling with food issues. And this is also a callback to some stuff that Pam talked to us about, right? So breathing, right? Just taking a breath. There's been some work done. I'll talk about some Judson Brewer here in a second. But, you know, if you have an intention, okay, I'm gonna, you know, have whole food, plant-based, and then something happens and you have a craving, right? You're like, ugh, these M&Ms are sounding kind of good to me. Well, you could set a timer on your phone, set a timer for 5 minutes. They've done research showing that most cravings last about 5 or 10 minutes. If you can get through that 5 or 10 minutes, you have an opportunity to make a different decision, right? You can still decide, right? The power is up to you. You can decide, you know what? This day has been so bad, I really do want those M&Ms, and that's okay, right? Or you can decide, I can wait another 5 minutes where the craving has passed and I don't want those M&Ms anymore. And minding the gap is kind of that same idea of there's a gap in there, right? Where you experience the craving and then you decide to take an action. And so that gap in there and kind of giving yourself time to explore, what is that? You know, how can I stay with those feelings? Judson Brewer calls it riding the wave. And so can I ride that wave long enough, or can I learn from this time so that next time will be different? And so that's what minding the gap means. Making a plan, right? If you know the holidays are coming up and you know, oh, I'm gonna have to spend, you know, a couple days with my mother-in-law. She drives me crazy. I'm gonna want to eat M&Ms and Oreos after I've been with her. I could make a plan, or maybe I won't do that. If I make a plan, I'm gonna call a friend, I'm gonna text somebody, I'm gonna take the dog for a walk, I'm gonna do these things before I eat those Oreos. And the support, right? So if you've got a friend, there's actual support groups, got people in here. That's what we're trying to create in here, is the support for people to make the healthiest decisions, and most importantly, being kind to yourself, right? So if you go through that craving and you end up eating the M&Ms, that's fine, right? Try to think about, well, is there something I could learn from that? Is there something that could be different next time? Being really kind to yourself, thinking about, well, if I told my friend that my mother-in-law was super mean to me and then I ate some Oreos, what would my friends say to me? likely your friend would say, well, you know, that was pretty crappy how your mother-in-law talked to you. And by the way, my mother-in-law's fine. I'm just using that as an example. But being kind to your friend would tell you to be kind to yourself, right? It doesn't help anything. It doesn't help the next time if you beat yourself up. That has no effect on whether something's gonna happen. So being kind to yourself is super important. Go ahead. So this is also a callback to Pam. Pam talked about this quote from Viktor Frankl. Between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. So that same idea about minding the gap or riding a wave, there is a space in there. And sometimes it's really hard to see. Sometimes you're experiencing that craving. And right now, maybe I'm saying this and you're like, I don't know. I don't know if there's any space in there. There is space in there. You just have to find it. And these cute chicks, they help you as well. Go ahead. So Rain, so Tara Brock and Justin Brewer have a whole bunch of YouTube videos. They have, I don't think we have any of their books, but they have books, they have podcasts, they have websites. And because of the tech issues we have in here, I was like, nope, I'm not showing the YouTube video. Go ahead and hit it. But I will show you what they say. And so what Rain means is, and this is just a different form of what I just talked about. So recognizing, okay, I'm having a craving. I'm gonna recognize that and maybe think about why it might be happening and allowing it, right? So if I tell you, and I think this is something that Pam talked about too, if I tell you not to think about polar bears, what are you gonna think about?
Polar bear.
Polar bears, right? So if you say, well, I'm thinking about polar bears right now, I'm thinking about polar bears right now. Okay, and just having compassion and acceptance, like, oh, that's fine, I'm thinking about polar bears right now, that's fine. And then maybe some investigating, right? Why, let's take it away from polar bears, because we're not gonna eat polar bears. So I'm thinking about those Oreos and I want those Oreos. Why am I feeling this way? Oh, I had a really stressful, crappy day at work, and so that's why I'm feeling this way. And I have a choice. Same thing, mind the gap. Right away, there's a space between stimulus and response. Investigate, what do I want to do here? You know, do I want the decision you make is fine for you, and it's fine in that moment. Yes.
Just want to mention, I have a copy of Judson Brewer's The Crazy Mind. I can pull it to the lending library.
Yeah, I read it. It's good. So, yeah. And he's got a whole bunch of videos on YouTube that are pretty short, where he shows how to practice these things. What's it called, Scott?
The Craving Mind.
The Craving Mind. And this is just a little quote. What is the bravest thing you've ever said? Asked the boy. Help, said the horse. So it's from a book. I think it's called The Boy and the Horse. And so, yeah, asking for help is a really brave thing to do. You know, making that choice for yourself, that you're choosing, you know, to do something good for yourself. Go ahead. I just have to say, I'm so happy this GIF worked. So whatever happens, it's a triumph, just that. So the little bears are hugging, they're moving, they're doing what they're supposed to. So I'm gonna call that a win. And so these are just some resources for food addiction. And one of the things that I really like, and these are both, we don't have them, I don't think, in our library, but they're both available at the Eugene Public Library, and they're also available to listen to. I think I listened to both of them. And one thing I really like about her, it's Julie M. Simon. She advocates plant-based living. So, you know, sometimes the people, you know, they want to talk to you about food addiction, and that's fine. And then you get to the food part and they start talking to you about chicken and lamb.
Yeah.
And like, that's a turnoff for me. I don't want that. She talks about plant-based living. So I really appreciate that. And I thought she had some really interesting things to say. Go ahead. So just a note on eating disorders, and this is also why Pam is here. So if anybody wants to get really in depth about this, we'll turn to Pam, and also just some beautiful starfish, right? Just beautiful pictures of animals makes everything better. So anorexia is, you know, severe restricting of food, and these are things that are, you know, a professional has to diagnose these. These are not things that you diagnose yourself. Bulimia is, you know, eating a whole lot and then purging. Binge eating disorder is eating too much in a short period of time that doesn't have the purging aspect to it. And then avoidant restrictive food intake disorder, also called ARFID, is not so much about body image, you know, these other ones, you know, tend to be about, oh, people want to look a certain way or lose weight or, you know, get muscly or whatever they're trying to achieve. The avoidant one is actually more about people can get very tuned in to the texture of food or the feel of it or the smell of it. And so they can become very restrictive in what they're willing to eat. Sometimes they feel like all foods are gonna make them vomit, or all foods are gonna make their stomach, you know, really upset their GI system. And so very severe, very different from, all of us have dealt with a picky kid, right? We've all had a pick, this is very different, this is, you know, diagnosable. And then orthorexia, I'm gonna hazard that a lot of women trying to be whole food, plant-based, at some point might get accused of this by a caring family member, right? And saying, oh, you know, that it's too much, you know, you're being too much. People who are trying to do raw foods, yeah.
That's me.
So, but it is so restrictive that it's diagnosable, right? And so one of the things that I think about is both Charlie and Scott have talked about different times of, you know, oh, you know, we're at a conference or we're at a family dinner, and so, you know, you end up eating at a restaurant that you wouldn't have chosen, and you're like, well, I'm just gonna do the best I can, right? I'm probably gonna get too much oil, I'm gonna get too much salt, I'm gonna get too much fat. It's one meal, and it's very obvious from how they talk about it. They're not beating themselves up about it. They're not saying that they can't partake of that meal. They're just saying, huh, I wish that had been better. But somebody suffering from orthorexia might actually say, no, absolutely not. You know, I cannot take that in. I cannot do that. I can only eat these healthy foods. And again, it's something that has to be diagnosed by a professional.
There's a bit of a, also a spectrum of orthorexia. Dr. Gregory has a couple of videos on it.
Great.
I'm not trying to understand what it is, because it's a restriction of what they eat without some reason, or.
It's really focused on, it can really become disordered because it really focused on trying to be healthy. And so it sounds a lot like what we talk about in here, but it gets to where it's very disordered. So if you think about some of those aspects of addiction that, you know, really taking over someone's life, that's all they can think about, and it becomes very obsessive. And so that's kind of some of the difference. Pam, would you add anything?
I don't think that's pretty good. It's when you get a diagnosis when it interferes with your life. Okay, so you can be one of these very, very conscious people. You can even choose, no, I'm not going to go out to dinner with these people because, but that's, you know, it's balanced in your life. And it's not like a lot of anxiety. So the initial interest in veganism and that lifestyle is excessive, and it is you until, and once it gets to a point where it's probably. Yes, yes.
Yeah,
Well, Charlie's trying to change.
I've had the diagnosis made by my grandkids and my kids.
They sound very qualified.
Yeah.
And so I just want to make a note here, and I don't think any of our books have this, but I see this on social media, and I feel like I see it in television sometimes. I'm thinking about foods in terms of clean or dirty. So thinking that, you know, oh, these foods are clean and these ones are not clean, and so I'm only going to eat these clean foods. And so I think there's implications in thinking about food in terms of purity. And I think that it can cause feelings of shame related to food choices and access. And it's really dichotomous, right? Thinking it's either or, right? Really black or white. It's something's either healthy or it's not healthy, and it demonizes certain foods. And I think this can have possible effects on mental health. I really like what Scott says, you know, it comes up in the class really often. Somebody will say, well, Scott, you know, is olive oil healthy? And what does Scott always say? Well, in comparison to what, right? And so that's the way to think about it. Olive oil is, you know, healthier than a pound of bacon, but it's not as healthy as a pound of broccoli, right? So it's all in comparison. So I think, I just think thinking about foods in terms, you know, you'll hear people say clean eating, and I just think that that can be dangerous. Okay. I just like this. I just think we can never tell people enough about eating a rainbow. It's pretty. It's got some bunnies. Like I said, my daughter is more of a vegan and not a whole food plant-based person. And so she calls my husband and I rabbits. She says we eat like rabbits. And Charlie has showed us pictures of his dinners and breakfast, you know, big bowls of vegetables, big bowls of salads, big bowls of healthy soup with whole grains. And beans, and that's how we eat, and so she calls us rabbit. And I'm proud to be a rabbit. Fine, I actually think she will become a rabbit at some point. So just a reminder to eat your rainbow. Okay, we're gonna do a little bit of discussion. The timing is actually working out really well, even with all of our tech issues.
Yes,
And
it
look at
is.
this cute cow. You get to look at this cute cow. That's the best. So, you can get however you want, but yeah, I just thought that, people could talk about how food's different from other addictive substances. How is it similar? How does our current food climate, or environment affect our food choices? And how is whole food, plant-based living supported or not supported? So, yeah, that would be great.
Kind of small already.
I mean, we could do. We could, we don't have to, yeah, if people don't wanna move, that's totally fine. So let's take number one. How is food different from other addictive substances?
Well, alcohol versus food is, it can be so similar to food you live.
Right.
With alcohol, it can be nothing.
That's true.
So with food, you have to be more selective and more quality.
Yeah. Yeah, that's definitely, and it's really hard if you are struggling with some of the fast food options. Can you drive from your house to anywhere without seeing a whole bunch of fast food on your way? Yeah. Really.
Well, the difference between natural foods and processed foods are, for me, are highly sugars and starches.
Yeah. Without, it's actually the food industry.
The drug industry. It's like, it's a pretty sick system.
Ted, the mic is coming to you.
Questions are, there are plant-based options in the Eugene Springfield School District.
I'm not sure. I mean, you know, my kids went through, obviously they were able to make do. I don't know if they actually serve plant-based options as entrees.
I don't think so.
Yeah, I would, my guess would be.
So my son, family was to raise, they do have a little bit of. That thing that
Yeah.
is.
Yes, yeah. I know when my kids were in school, they had a salad bar and qualitatively it just didn't look like what I would make. Very institutional and it didn't look great.
Yeah.
Could you?
Yeah, to answer your question, the only, different thing about food from other addictions is food often.
That's true, yeah, no, that's a great point, yeah, Charlie and Scott can say, but doesn't your body kind of look at alcohol as poison?
I would say, yeah. Yeah.
Kills the microbiome.
Yeah.
Carcinogen.
Your body doesn't really want that.
Not really.
Yeah, that's a great point. So, go ahead.
What do you think about the different 12-step programs that you can with helping conditions like this?
I think that they can work for some people. I think that it doesn't work for everybody. And I think that's one of the contemporary things that we've learned in the last 20 years ago, 12-step programs were kind of in, even when I started, in the work that I do, it was pretty rare to have any of our treatment centers in Eugene not be 12-step programs. And I think it's really diversified. We still don't have enough. We do not have enough treatment in this county or any county or probably any state in the United States.
We need more.
There's overeaters anonymous. So
Yeah,
if-
there is.
If it's an eating
Yes.
issue, and I think that, and they cover like all eating issues, it's not necessarily just overeating, I think that's just the right of it.
Yeah. I think that for people looking for whatever kind of treatment they're looking for, sometimes it's like looking for a counselor, right? You're gonna find the exact right counselor the first time you make an appointment. Maybe you'll get lucky, but it's the same with trying to be in recovery. You might access some place like Serenity Lane and go there and you say, this is not really what I want. They are not meeting my needs. And move on to a family or move on to one of the other ones that we have in town. And now we have with COVID, what else did we get? We get telehealth, right? And so we're not even stuck with just the places we have in town anymore. And we can also have treatment and recovery in a telehealth environment. So that's kind of been a game changer. Oh, can you go back to the questions?
You're blocking me.
Sure.
You're blocking me.
So I don't know, did we cover this? How is food addiction similar to other addictions? Anybody thoughts on that?
Well, I think it's, when it turns into chemistry in our body, and some of the stuff, the mixtures we get from liver.
Yeah. maybe that's true. And I think the thing that really can be an issue too is just things combined together, right? It's pretty, usually people are not just using one thing. Like we talked about, food is normal, right? And so if you're drinking or smoking cannabis or whatever, there may be some associations with unhealthy food. And so if you're doing one, then it's really easy to move to the other one.
I just saw, I didn't hear that. New York
Can't
City.
hear.
Can't hear? Okay.
The New York City School District ruled out completely ban hot dogs and artificial, meat combinations.
Right.
So that's a step, in a good direction.
Yeah.
So not enough, but they're thinking about it.
Yeah, because that's Scott told us last Friday, those are class.
Yeah, class 1 person.
Yeah.
A lot of food.
Yes, so we got rid of all the process.
Yeah, and there's
New
some,
York City.
there's some school districts, I think in California, Debbie was telling me about it. That are making sure that plant-based milks are available for kids, in school lunches. So that's also, huge policy change, right? I love that in public health, right? So that's just across the board, a big change, but it hasn't taken years.
At school, I don't even think they offer water, and plus it's plastic bottles and stuff, and things how they store it, but they used to be just milk and chocolate milk, and so. That's good.
Yeah. Yes. So how does our current food climate environment affect our food choice?
It says there's a microphone issue. So I don't know if they can hear or not. Can you hear now? In the room? Maybe not.
Not the room. We can hear you and we can hear the lady, but we can't hear in the room.
Oh, you can't hear in the room. Okay. It's still on. Maybe we could use the microphone, the two of them together. We've got another one. Okay.
So the question that we're asking is, how does our current food climate environment affect our food choice?
Places like Florida, when they have some kind of a divide on the oranges or, different, weather disasters that affect fruit, vegetables, corn, so I think a lot of it's impacted just by timing.
See differences. Your default microphone has changed to microphone USB and they don't know how to be used.
I mean, I think I was meaning more that, but I mean, that's a great. No, you're fine. You're fine. That's a good point. Yeah.
Okay.
Well, yeah.
Well, I think also the way they're raising crops and stuff is a problem because they're really bleaching out a lot of the nutrients, and I don't think food tastes as good as it did a fruit.
Yeah. Yeah.
So I think that's a real problem. That's why organic is better because they start. Part of the problem is that the soil's dead, the worm, right? Microbiomes and lizards and stuff growing to nurture the plants, and that's why organic food tends to be better because those farmers tend to like have pesticide free. They're not killing the organs of the plants or relying on their stuff.
Right. And that goes back to what I was talking about at the beginning, the social determinants of health, right? Not everybody has access to be able to buy, to buy organic foods. That takes money and means and resources and education to know that that's something you should be doing, and not everybody has access to that. So that's pretty, yes.
I just saw news where they were talking about, well, it looks like USDA is trying for beans instead of meat in the food pyramid which they built. But their big beef has lobbies. Broccoli doesn't have a lobby. And I would be willing to bet that it really doesn't count, because there's going to now be too much food where people can comment. And the beef is going to come in there, and it's going to come in there and form it.
Yeah.
Or we should go with it.
Sorry, I'm just trying to get the online people to be able to hear. Yeah. Yeah.
I noticed that when I tell people that I'm vegan, that I get this snub nose thing, and like there's this, like there's some paranoia that somehow we're trying to change everybody else's life.
Yes.
And I understand that exactly. I had the same problem when I moved here from California, and I had to come to place. I just got so much crap for coming from there. And yet I'm coming here with with money from California for my pension, and buying a house that's not in the neighborhood where they can afford to buy a house. So I'm bringing
right.
the places I'm tired.
Yeah.
And so I just thought I can't figure out, and I don't know how to talk to people about like opening their minds about that if they think that somehow I'm being snobby because I want to, because I'm not saying you have to do it.
Right. I think all of us have encountered that where people feel like you're judging them, even just by the act of how you're living, they feel judged. Maybe Scott and Charlie have some thought. I haven't had any. I work in the public health department, and I have no luck. I have not converted anybody.
People that want to know that are concerned for their health, concerned for the applicants, concerned for the planet. So you just find those people and talk to them. You don't have to go out and convert anybody. There's lots of people that care. And those people.
Right.
And so I do a problem myself because
right.
So,
right. Yeah. Right. Yeah. And so again, being kind to yourself when you're in those situations, right? You're doing the best you can.
One thing that really frustrates me is you talk about I was working in people in Dr. Gregory. Well, there's another doctor that the opposite of some of the things that Dr. Gregory stuff like we should need open, should need to look at all this stuff. And you can find this and that and the other thing. So I completely agree. So I decided to believe Dr. Gregory because you guys. But yeah. Another person is the MD, supposedly.
Which means you're right.
Yeah,
Yeah, we talk about in class a lot of who you trust. Like, you can find studies to support anything we're looking for. Like it's kind of like, oh, this is my value system, this is the way I want to go there. You can find studies that support that. Yeah, those are the best, but like short term versus long term outcome based versus numbers based. I can explain more. I'll just talk about that. But what's most important is that finding what's the balance. The balance of the other is what is it going towards. And we always talk about the blue zones, for example, where no keto food, carnivore food, there's no processed food there's a lot of times there's more in common than people think, but and there's the difference. You know, obviously carnivores like the opposite of totally plant-based, but there's never been a study of carnivore diet in recent articles. There's, you know, long lived populations of carnivores. So it's just, you know, we have some common sense too. As long as they're trying to sell a book, there's like a half truth a lot of times in certain books, the premise of certain books and things, and then you run the whole book based on that. Cherry pick certain study, and there you go, the book. It's something that people, like eating bacon, so just buy a diet with eat bacon, and then you're more likely to buy it, because it's more just about marketing.
Hey, Charlie, we're not hearing very well.
You know,
So as Scott mentioned, no other diet has actually been shown by angiographic analysis to unclog coronary arteries, our number one killer in the country. So there are two studies that use whole plant foods that have shown that. So for people who come up and say, you need to eat something entirely different, I'd say point to the studies. I want to reinforce what Scott had to say here. And the other thing that I choose to talk about is not only, I just lost my train of thought for a moment, the demand setting in. There's an herb for that, yeah. There was one other thing that I wanted to reinforce as to, I bring out my little folder of people who have sent me thank yous. I send the cards, the letters, the emails, and I say, you know, when I used to treat people, they never got better. They didn't reverse their diabetes. They didn't reverse their kidney disease. They didn't get rid of their chronic pain. But when I chose to tell them to do this, like eat whole plant foods, this is what I get. And now I wake up every day wondering, am I going to get another one of these? And people listen to that. They think about it. And then I add one more thing. I say, I asked every medical student, every class participant over the last 13 years, find something wrong with Dr. Greger's work. Find something that he said here that you can say, this is not right. And I've yet to have a person tell me that. Now, Dr. Gundry, I kind of figured that because I hear that from enough people that Gundry is the person that they believe. He's an MD, he's a cardiologist. He must have information which is appropriate, correct. But if you listen to Dr. Greger's video about his review of Greger's work, his very first reference on the Plant Paradox book is totally wrong, totally inaccurate.
No.
No, and you don't. Okay.
I think the other thing that I would add too is that, you know, when they're trying to sell you supplements, I think that, right, that tells you what you need to know.
That's another great
And
point.
so Dr. Greger, he makes it very clear that, yeah, he's selling books and the books all go to charitable foundations. And so he's not making money on this. So some of these other people that sometimes they seem reputable, but it always makes a red flag go up for me when they're like, oh yeah, I've got all the science and also you should buy my $40 supplement. So some people in the medical community say when you buy a supplement like that, you're just buying very expensive urine. So something to think about. It's just, you're just peeing out that $40, right? Yeah. Who knows what this is? It is a quokka. From Australia. Looks like a stuffed animal, right? I mean, it's just the best. One more. So here's just some resources. I think these, did the slides get posted? I don't remember, but there's a recording. So these are just some resources. So Alcohol and Drug Helpline, Quit Now Oregon, it's for tobacco. There's a problem gambling helpline funded through lottery dollars. And 988 is your mental health suicide prevention number. And one more. So just in closing, I like this quote from Jane Velez Mitchell. Choosing a plant-based lifestyle is an act of empowerment where we take control of our health and contribute to a more compassionate world and make these people have a better life. And again, I really, have compassion for yourself and kindness for yourself. And we have a couple minutes, so if anybody has any questions, we're all up here. So anybody has any questions, we're happy to. And also if people are tired on this rainy Friday night, we can also end a little early. So whatever the group's preference is, we are good. Yeah.
Well, I've only been here 5 years, and I come from Southern California, and it's darkness and it's rain. Is there some type of nutrition that could like kind of boost that part of that darker side?
This seems like a medical question to me.
I too moved here from California just about a year and a half ago. It's only been 2 years. I get my blood work done every 2 years or so. I always check with B12 levels and D and stuff. Never had any low levels ever. And this was the first time I had low D levels from moving to Oregon. And, it's because there's sunshine in California and I haven't gotten the sunshine for about a year. So I started supplementing D for the first time, and I'm hoping that will help. I mean, I don't mind supplementing. I supplement B12 as a vegan, so I'm just adding D into there. So I would suggest that for do it every day. Yeah.
Yeah, if you had like seasonal affective disorder, you big antibodies to that. Seasonal affective disorder. You want to say anything about that? No.
I think it's overdiagnosed. I think it's really going into hibernating in the future. Or strongly affected. And there's pretty good life cycles for that. There's one of those bright lights first thing in the morning that can really help if you're light. I think I'll get some good stuff to do that. I want to see this stuff. But the timing of the lights is first thing in the morning. And it's a really bright light. For one specifically designed. No. Okay.
Good sleep is important. If you got to get at least 7 hours and avoid, the sleep hygiene handout, avoiding the blue light and all that. So those are last website, lifestylemedicine.com, the resources section, 6 pillars of lifestyle medicine, 1-page handouts for each of the 6 pillars, and the sleep health one has all tips, the sleep disruptors, tips for better sleep, all that stuff. The American College of Wisdom. So how, not just the nutrition aspect, but getting all 6 of those pillars to make you feel better, more positive.
Yeah.
Yes. Dr. Gary has videos on that where you show what the sugar did to the brain with the dopamine, and then another one separately with fat. And then we think, I don't think there was a study on salt individually, but it's going to have the sugar, salt, fat, all those things together. It's yeah, and then high calorie density and all those things tend to go to foods that are really high in calorie density. Also, that it's like unnatural. salt substitutes. Potassium chloride, like there's Misuse ash, and we use lots of herbs and spices rather than just salt.
So I think people can be drawn to different things, and it can be very separate. I've never really had a problem with salt, oil, plenty ever have salt, oil at home, but the sugar, that is so much harder for me personally. So I think that there's these different things, and my husband's the opposite. He loves the salt, and the sugar you can take over. So we all have different things we're drawn to.
I always thought sugar would always go good for you for and now you say that that's okay. So can you remind me what
Process, yeah. So extra virgin olive oil is good compared to cooking oil, but not good compared to olives. And that would be the whole food, fiber and nutrients and maybe extra. All oil is 100% fat.
there's a lot of hype out there that has been about cooking oil. Or cooking it anyway.
Good marketing for cooking.
Yeah.
It's okay on your skin, but don't eat it.
Oh.
I struggle with the original pan at the office cookies, and I just go in there and just
Yeah.
and that space between making that decision gradually is so short, and I'm trying to work on trying to stop myself from anger, trying to stress myself, but it is hard, so I can learn that how to that's my struggle, and I realize that now I'm trying to with that. So what you share and the book and everything like that, and the right.
Yeah, there's some great videos out there, and then there's several books. And also just, before you even watch all that, just set a timer on your phone. Set a timer for 5 minutes. They have done research that most cravings are done in 5 or 10 minutes. If you can get through that 5 or 10 minutes, but also being kind, you're going to get through the 5 minutes, and whatever decision you make is whatever decision you make. And that's for that time. But and it's a muscle, right? You use it and you say, well, this time maybe didn't work out so great, but I learned a little bit. Next time might be better. So thank you. I appreciate you saying that.
When I was working, I used to put the donuts on the shelf right outside my office door. And so I would just put up a sign that donuts are in the library.
Nice. Yeah. In public health, we call it an environmental change. So you just say, no, I don't want those. Yeah, that's great. I love that. Well, folks, it's 29 according to that military clock we got.
Okay.
So, any burning questions that'll be keeping anybody up at night, or are we okay ending for tonight?
Next week is online only because there's a Boy Scout event here next Friday. So we'll just be online. Yeah, then 27th we'll be back.
So we're ending the meeting. Thanks for coming.